Hi everyone, this is Neil Reiter, also known as the Wax Whisperer. Thank you for joining me in my latest video. We have here a patient who attended with bilateral blocked ears, and we're just commencing with their left ear first, which is the worst ear out of the two. And you may have just noticed the entrance of the ear canal was quite inflamed, swollen, there's a bit of edema there. And that was in part because the patient's been rubbing their ear because their ear is blocked in an attempt to try and unblock it. But also they have developed a reaction to hydrogen peroxide drops that they've been using to try and soften this skin plug, which, to be fair, has softened it. The last time the patient attended, they need to attend, I think, twice a year. The skin plug in their left ear is rock solid. And the hydrogen peroxide drops has softened it. And as a comparison, when we clean their right ear where they haven't used any drops, you'll see the difference in consistency. However, what the hydrogen peroxide drops has also done is made just the entrance of the ear slightly tender and inflamed. They've been using it for quite a while, these drops. They thought if they used the drops, then they may not need to have their ears professionally cleaned. The drops will remove the wax for them. But unfortunately, that's not the case. Once you've got a substantial buildup of earwax, any form of drops that you'll use will either just soften the wax or break it into smaller pieces, but it will still remain in the ear. So they put themselves in, and the reason why this patient has developed a reaction using hydrogen peroxide based drops is because our ear is slightly acidic in nature, and the acidity helps to repel insects, believe it or not, and also to inhibit harmful bacteria and fungi growth. When you use hydrogen peroxide based drops, which is alkaline in pH, it neutralizes the ear, so the ear becomes less acidic and more neutral, and sometimes even slightly alkaline. And that then can cause a reaction skin on the skin flora. So the skin that lines the ear canal, it's got its own ecosystem there, where you've actually got healthy bacteria and healthy fungi protecting the skin and from more harmful versions and variants. But once you've neutralized the skin flora and it's less acidic, then more harmful bacteria and fungi can colonize on the skin flora and reproduce and cause a bit of an infection. And so deeper in the ear, the patient's ear is not too bad. You can see the ear canal, it's got a nice fleshy appearance. So it's just the entrance. Now, this plug is quite a tricky one to remove. Will be classified as a keratosis obturans? I would say no. If you watched my video yesterday, I presented with a case of keratosis obturans, which is a buildup of dead skin, typically more medial. That's why I would say this is probably not keratosis obturans. This is more lateral or the midsection, and the patient wasn't experiencing any pain. The hallmark of keratosis obturans, there's 4 different grades, but all of them there's some level of pain. So this patient, they just have a lot of dry skin, predominantly at the entrance of the ear and the outer third of the ear canal. And you'll see as we go in and out, more so on the right side, you'll see the dry skin flakes this patient's got at the entrance of the ear. And they just fall and they don't migrate, and they collect. So I just trying to get in and behind this. It is a challenging one because of how narrow the ear is. And with the hook, because the wax and the skin plug is a bit softened, it just dissected through it as opposed to bringing it out. I've been saying that, I did get a nice sizable piece out here. With the Jobson horn, it's difficult to use it in this particular case. I think